হাই, গুড মর্নিং ফ্রেন্ডস। আমি চলে এসেছি তোমাদের ডিমান্ডের ফার্স্ট টপিক নিয়ে, দ্যাট ইজ এবিজি অ্যানালাইসিস। ABG analysis is a broad topic. I think it will be not good enough to cover all the topics in a single class. So today I will only discuss the basics of ABG analysis, and next classes will be on the compensatory mechanisms and its specific management. So the full form of ABG is arterial blood gas. Arterial blood gas is a kind of blood test that is performed using blood from an artery. It involves puncturing an artery with a thin needle and syringe, drawing a small amount of blood from an artery. Approximately that is 2. So now we have to learn the common sites for collection of blood. So the most common sites for blood collection is radial artery on the wrist, sometimes femoral artery in the groin, and other sites also be used that completely depends on the patient's physical condition. The blood can also be drawn from an arterial catheter if the patient already have this. So on a ABG strip there are so many parameters like pH, partial pressure of oxygen, partial pressure of carbon dioxide, base axis, anion gap, and so many electrolytes parameters like sodium, potassium, and hemoglobin also there. So for the basics of ABG we have to learn the few things. So now I will discuss the basic component of ABG and its normal value. On the picture you can easily see the component and normal value. First one is pH, that indicate acid-base balance in blood. Normal value is 7.35 to 7.45. Second one, partial pressure of oxygen in an arterial blood. Normal value is 75 to 100 millimeter mercury. Next, partial pressure of carbon dioxide in an arterial blood. The normal value is 35 to 45 millimeter mercury. Fourth one is bicarbonate. Normal value is 22 to 26 millimole per liter. And last but not the least, that is oxygen saturation. Normal value is 94 to 100%. It's need to confirm whether the blood is collected from an artery or vein or that is mixed blood. Next, we have to learn the standard value for an ABG. For pH, that is 7.4. For partial pressure of carbon dioxide, that is 40 millimeter mercury, and for bicarbonate, that is 24 millimole per liter. To keep in mind 4 things only. In case of acidosis, pH value will be decreased, and for alkalosis, pH value will be increased. Metabolic condition related to bicarbonate values and respiratory abnormalities is related to partial pressure of carbon dioxide values. Now I will give you the master key for interpretation of ABG. In case of metabolic abnormalities, pH proportional to bicarbonate value, and in case of respiratory abnormalities, pH inversely proportional to partial pressure of carbon dioxide. Look forward for its interpretation. First one is metabolic acidosis. So by the name acidosis means here pH value will be decreased, and metabolic means that is related to bicarbonate value. So here bicarbonate value is proportional to pH value. So pH value is decreased as well as bicarbonate value is also be decreased. Second one is metabolic alkalosis. So alkalosis means pH value will be increased here, and metabolic means that is related to bicarbonate. So here bicarbonate value also be increased. Third one is respiratory acidosis. So by the name acidosis means pH value is decreased, and respiratory means it is related to partial pressure of carbon dioxide in arterial blood, that is inversely proportional to pH value. So here pH value is decreased and PCO2 value will be increased. And last but not the least, respiratory alkalosis. Alkalosis means pH value will be increased and that is inversely proportional to PCO2 value. So here PCO2 value will be decreased. Next class will be coming soon on advanced ABG analysis. So for more update, like, share and subscribe my YouTube channel and press the bell icon for early notification.